Alrighty, well, hello everybody. Thank you all for joining us today. It's just a little after 12, so in the essence of everybody's time, we'll get it started shortly. This is being recorded and it will be shared on our YouTube channel probably later this week. So if anybody misses anything, they will be able to watch the recording. I'm Rachel. I'm the health educator and advocacy coordinator at the Epilepsy Foundation of Northeastern New York. And I am extremely pleased to invite Dr. Jack Lansing to present on understanding driving laws related to epilepsy and seizures, which has been a big topic recently in the last few years. Dr. Lansing is an adult epileptologist at Albany Medical Center, and he is also the new chair of our professional advisory board. So we are excited to have him on board. All right, you can take it away, Dr. Lansing. Thank you so much for being here.
Yeah, of course. Thank you for having me, Rachel. Today we'll talk about understanding driving laws and related to epilepsy and seizures. This talk will primarily be talking about epilepsy. I did also throw in some other information as well, kind of just giving you a layout of how laws in regards to driving are for the state of New York. So just to kind of show you some of the objectives I hope to get through in this talk today, we'll talk about seizure characteristics that impact driving. I will use the terminology loss of consciousness, awareness, or bodily control many times because that's kind of the main impacting factor in regards to driving. But just to kind of lay that out. We'll also identify additional medical conditions that can also have driving restrictions, distinguish some of the criteria that determine driving restriction duration, and define the patient's role as well as provider's role in driving restrictions. So just kind of giving you an outline, we'll start with driving restrictions and its history. So the development of restrictions. Right from the get-go, as soon as we had cars in development, people soon realized that we might have to put restrictions into who should and shouldn't be driving. There was risks that whenever anyone would lose consciousness abruptly or lose awareness, maybe they shouldn't be driving. This was very quickly associated with seizures and with epilepsy. Something you hear a lot when listening to people who have epilepsy or listening to the discussions in regards to epilepsy. There's a lot of stigma related to epilepsy, and this kind of was a little bit chicken and the egg. It was already pre-existing, but also got worsened once people found out that maybe they shouldn't be driving because they have seizures. As we know, seizures are not all created equal. There's different types of seizures and different impacts that they can have on your day-to-day life, as well as they're not necessarily all the time. And what happens to someone who has a seizure once a week versus someone who has a seizure once a year versus someone who hasn't had a seizure in 10 years? When can they or can't they drive? So they developed in the 1950s this idea of a seizure-free interval, or SFI. And then by the 70s, they actually became much more diligent and accustomed to the idea that even if someone does have a recurrent risk for seizures, aka epilepsy, they could potentially drive if it's controlled. So in looking at the evaluation of these loss of consciousness, LOC, or loss of awareness, LOA episodes, and you'll see I use that acronym a lot, LOC, LOA. Guidelines were eventually developed based off of comprehensive review of medical literature, national trends. The Epilepsy Foundation, for example, was very adamant on certain research studies and certain ideas as to what could that seizure-free or episode-free interval be. You also had people or groups such as the American Epilepsy Society, the American Clinical Neurophysiology Society, and other major groups weigh in on this. At the end of the day, each state, however, has individualized driving restrictions. I will focus mostly on New York's driving restrictions, but just keep in mind every state is different, and I make sure to advocate that to my patients. Restrictions are based on a freedom of episodes with loss of consciousness, awareness, and are usually in month intervals. Sometimes you'll hear people or individuals say, I can't drive for a year because I had a seizure. which is not necessarily true. There are other qualifiers. So 1 year, 6 months, even 3 months in certain situations, and also dependent on what state they're in. So in regards to the state-specific guidelines, how this came about was for seizures, they use this model consensus guidelines with multiple foundations saying, okay, this is what we recommend is the best idea. Interestingly enough, they these guidelines from these different models recommended a seizure-free period of at least 3 months with an individualized assessment by state medical advisory board. I bring that up just because why that's interesting is that that's not technically exactly how New York State is run or how most states are run. Only 18 states began to revise their driving regulations after 2004, because prior to that, all of them just said 1 year. Um, and just because the recommendations of these groups, such as the Epilepsy Foundation, had recommended 3 months plus an evaluation by this idea of a medical advisory board, not every state said yes to that. Some states said, well, we still feel more comfortable with 6 months, for example. Others said maybe 3 months is fine. Just to kind of show you how different it is across the country, as well as in parts of the world, each state is different, like I said. Um, Looking at North America, looking at the United States, you can see that the color coordination has to do with what their recommendation for a seizure-free period would be. New York is listed as 12 months. It's that darker gray. You can see that actually in a few other areas. In some areas, it's a darker color because there is no fixed period. They actually want much more information rather than just a timeline saying, yes, you can drive or no, you can't drive. There are some individual states that will say even 3 months is fine enough. A fair amount, as you can see, usually recommends 6 months, but it can be different depending on the states. Different countries throughout the world have also had different recommendations. Sometimes they'll even recommend 2 years rather than just recommending a 1 year time frame of seizure freedom or episode free freedom. So every group is different. Um, Going back to the picture of the US, there are certain states that are underlined. And for example, Pennsylvania is underlined, New Jersey, Delaware, California, Nevada, Oregon. We'll come back to that, but those states are actually what we call mandatory reporting states. So they have a whole different designation as well in how they are run in regards to driving laws. So going back onto these state-specific guidelines, how do we review these cases? So the actual review system can be a fixed interval, meaning that when someone is placed into this review, they get evaluated every few months, maybe every 3 months, every 6 months, every year. It can be individualized. So they say, well, why don't you follow up with us again after you get whatever testing? Or maybe you can follow up whenever you've shown that you've been on a medication for a certain amount of time. And then there's a hybrid. So they could have both. So maybe they say, okay, we want you to follow up every 6 months for a specified amount of time. But we also want further information from your neurologist. And we can get into it, other specialists as well. People who actually review these driving restrictions can be a medical advisory board, the individual physician. So there are some states where the physician themselves are the ones who say yes or no to your driving. The DMV itself, taking physicians out of the equation, or once again, a hybrid, a combination of all of those factors. And we'll talk about what New York is. With time, seizures were always included, but they started to include other organ systems because at the end of the day, what we care about is not seizure, but loss of consciousness, loss of awareness, or loss of bodily control. So, in addition to neurologic issues such as epilepsy, you also could have cardiac issues, endocrinologic. sleep disorders, psychiatric, and pretty much anything that could in fact impair any of those components. Um, Loss of bodily function also considered in the restrictions, like I said. If you have a movement disorder or you have something where you physically can't move one part of your body, that could be brought into play as to whether or not you might have to have some kind of driving restriction. Just because, as you could imagine, trying to maybe maneuver your foot or your arm, it could impact your ability to drive safely. So now looking at the rules of the road, this QR code actually, and if you want, feel free to kind of go in there. This will bring you right to the New York State DMV site. This is, I believe, the forms that are actually trying to, that you would use in case of involvement by the DMV or concern that you need to have the paperwork filled out in the near future. So New York State, the DMV at New York State is a hybrid. So you have physician input as well as a medical advisory board from the state of New York that's involved in reviewing these cases. How are these cases documented or brought to the attention of the New York State DMV and Medical Advisory Board? Following an accident or an incident, police reports generated could potentially bring this up if there's concern there has been a seizure or an episode with loss of consciousness awareness. Personal reporting, so this actually can be done by physicians, by family members, or by the individual themselves. Documentation through an MV 80.1 form, which is a physician-based form. So if the physician actually fills out on their behalf, it's brought to the attention to the medical advisory board. And there are various forms available depending on specific circumstances. The medical advisory board is very specifically looking at the medical diagnoses. It becomes a little gray when you have other things such as the use of alcohol or substances involved that are affecting driving. So, what is an episode? Alteration of awareness or bodily control sufficient to impair the ability to easily operate a motor vehicle, which we've already talked about. Each case is individually assessed by the medical advisory board for the state. And then this is a grouping of physicians who are looking over each individual detail. And then they're the ones who also will say, well, this doesn't make sense. Why did this happen? Has this ever happened before? Maybe the MV 80.1 form didn't actually give enough information, or it was a little confusing at times. They might look for other complicating factors or details. Like, for example, maybe just because someone has epilepsy, they might also have sleep apnea. So maybe they fell asleep while at the wheel. They don't want to just assume they had a seizure just because they were found down in a car. Kind of going once again off of that idea of the stigma of epilepsy. But at the end of the day, the epilepsy-free interval is the main criterion based on retention of a driving license and being able to drive. So the New York State Medical Advisory Board reviews each individual case one at a time. Multiple considerations in the decision. So is this the first time? Have there been multiple accidents in the past? Are there multiple medical conditions involved in this individual? What were the circumstances of the accident or incident? And then also information from various medical providers or non-medical reporters, such as family letters, anything else that's written in on their behalf, that can be taken into consideration. The medical consultant in the medical advisory board may request additional information as well, without necessarily removing the license completely, just trying to get a better idea. And there might also be other components needed after the fact, just because your driver's license is retained. There could also be a little asterisk saying, yes, you get to keep your license as long as maybe you have a driving evaluation after the fact to see if you still are okay to drive. Going through the intervals of how long someone has to restrict their driving for. So episode freedom for 1 year. This is what we usually will lead off with, saying, oh, you had a seizure with loss of consciousness. You can't drive for 1 year by New York State law. You wait the 1 year, automatic renewal of license. It may be renewed without review by the medical advisory board. That's just, it's been a year since the last seizure. That can happen. This is reliant on reporting from the provider or other reporter if there are concerns, especially if there's concern that someone's under reporting how often they're having seizures. Sometimes they may say, "Oh, I haven't had a seizure," and then you find out from family members it's like, "No, they're seizing once a week," or you might find out that maybe they haven't been taking their medication. There could be those kind of reports that might be brought in that might need to be disclosed to the medical advisory board. 6 months. So, as when I'm consulting or discussing with a patient, I will say you can't drive per New York State law for 1 year or 6 months with a physician approval, which means physician approval through documentation with this MV 80.1 form. The episode should be in quote good control, aka there hasn't been one in the interim. Um, and no clear redemonstration of episodes that have affected consciousness, awareness, or bodily control. There is a little caveat where you could potentially have 3 months of driving restriction before you can get back to driving without concern um, after meeting approval by the medical advisory board. They have to have one of these kind of criteria. So first provoked episode of loss of consciousness or awareness or loss of bodily control due to, quote, a clearly defined non-recurrent etiology such as medication provoked event or immediately after head trauma. Someone got put on a medication and then the medication got taken away abruptly. They have a seizure. They've never had that happen before. That could be it. They're walking down the street, something hits them in the head, they have a bleed, they have a seizure in that setting. That could be it. Um, that becomes a little tricky as well because sometimes people might have head trauma while driving. So airbag deploys, they have a bleed, they break their nose, something like that. If a police officer or another individual reports that, they were found without responsiveness at the scene of a crime or a scene of an accident, you can't you can't know necessarily, especially if the individual who was in the accident can't tell you. So it becomes a little hard to parse through that, but you just try and go off of whatever information there is. Um, and then kind of going on that same vein that we were talking about, episode due to physician-directed medication withdrawal in controlled individual. Someone goes into a epilepsy monitoring unit and they're taken off their meds and then they get home and they have a seizure. That could be a provoked event. There still is a driving restriction technically by it, but it is provoked. Um, Same thing could happen with someone who wants to wean off medication. We'll get to that later on. But someone who weans off medication and they have a seizure, that could maybe even also be a 3 month. Um, and then the other 3 months would be following definitive treatment for a condition, and that's a little vague. But for example, a cardiac pacemaker. So someone has their heart just stops, they go into asystole for a few seconds, and they get into a car accident. If they have a pacemaker placed, they don't have to wait the full year or even the 6 months. They just have to wait 3 months, making sure that there hasn't been another event because they've had a definitive treatment involved. That becomes tricky as well, especially with epilepsy. People who have epilepsy surgeries, does that mean it's a definitive treatment? It should be, it could be, but it's not always a guarantee. So it's kind of left to the medical advisory board as well. Um, and then there's no driving restriction if there's a seizure that does not involve loss of consciousness, awareness, or bodily control. And that's why I know it's going to be redundant by the time I get done saying it, how often I use that terminology. But it's important to know because if someone has a seizure that is just, for example, they have an aura, like they just have this impending doom that lasts 15 seconds and then it goes away and they just kind of feel a little tired. That's different than someone whose right arm starts jerking and then spreads into their face and then they lose consciousness with a convulsion. Or if someone has even something like a sensation change in their left arm without motor involvement, that should not necessarily impact their ability to drive. So sometimes with treatment, we can have people still having seizures, but the seizures are much smaller, those focal aware seizures, rather than having a focal seizure that leads to what we used to say secondary generalization, or now we say bilateral tonic-clonic, where you stiffen and jerk. Another interesting one is there's no driving restriction if there's exclusively nocturnal episodes. So all of the episodes are happening in sleep. That can affect driving restrictions. Now, granted, this pattern needs to have been established for 2 years. So if someone comes in first seizure they ever had, and it was out of sleep. They technically have to still, not technically, they do have to still follow the original laws. So they can't drive for a year or 6 months with physician approval. Now, if they have another seizure 8 months later, they once again can't drive for a year or 6 months with physician approval. But if they then have a third and it's been a year and a half since that 8 months, so in total, 2.5 years, there isn't that restriction anymore because they've now established a pattern that they only have seizures out of sleep for the last 2 years. And so they don't have to worry. If there is a daytime event that occurs, it immediately resets the whole thing. So you have to continue to restrict every time until you've shown that your pattern is only at night. So that is, once again, kind of a caveat more than the actual rule. Follow-up. So people go through this process. Drivers may be followed in the DMV reporting program depending on circumstances. That's usually laid out by the medical advisory board. So that is dependent on their review and recommendation. The follow-up, it could be a no follow-up necessary. It could be, why don't we follow up? I want you to resubmit an MV80 form every 3 months for a 6-month period. It could be resubmit the MV80 every 6 months for a 12-month period. Or it could even say, why don't you do it once a year? Send in that MV80 paperwork once a year. They can also enroll you in the program and say, I want you to follow up, sending it once a year for up to 3 years. That's very common for our individuals who have epilepsy, where they will typically remain in the program for at least 3 years. But not always. It depends on a lot of different criteria. Some additional requirements, the medical advisory board may request a favorable evaluation by a certified rehabilitative driving specialist. So they may say, okay, well, I'm glad you haven't had an episode, but maybe I'm concerned that for example, if they had a stroke, maybe your right arm's not working as well. Maybe you might want to see if you're able to turn appropriately and use your foot appropriately. And reinstatement of your license is really contingent on the results of that test. Sometimes this also can be used in evaluating people who have dementia or there's concern of memory issues because if they can't remember how to, for example, turn on the car or appropriately navigate busy streets, they might not be able to get their license back. And then you could also ask for specific requirements. Is there any concern for chronic pain, substance use, other things that could affect their awareness of how they're driving? Do they have weakness? How bad is it? Hard to say. So just taking a step out of epilepsy for 1 second, just showing, because obviously people with epilepsy can have these. We'll also talk about some other things that other individuals that could have driving restrictions with their conditions. And of course, also our patients with epilepsy can have multiple conditions. But like I said before, the cases often vary due to seizure semiology, so what the seizures look like. If you have focal aware seizures or a prolonged aura or nocturnal seizures, that can affect what your driving restrictions may be or might not have driving restrictions. As we said, the episodes with loss of consciousness or awareness can be challenging to assess. Individuals might say like, oh, no, I was fine. I didn't lose consciousness. And then you'll find out that like someone else was in the car with them and just was like, yeah, they were not answering to their name for 15 seconds or at 30 seconds, or they may have started to have automatisms, lots of different things. And sometimes you might have to have additional testing to identify the impairment. Sometimes there's driving simulations. This is a nice tool because this actually allows for individuals to be tested without actually formally put onto the road. So it's almost like a video game. They get to see what their delay might be. This comes in handy, as does the next test, especially for our individuals who have either absence epilepsy or staring seizures. I apologize. My office sometimes will turn the light off on me if it hasn't seen any movement. So, uh, tap testing, by the way, that's another test that can be used. Tap testing is something that when someone has an EEG on, we can look to see if what's going on in their brain waves correlates with them physically feeling something. So literally, we'll have individuals tap on a lead on their EEG, and it creates something that we can see on the screen, and we can also see their brain waves still going on. So as they're tapping, if all of a sudden we see what should be maybe a pattern that we see in between their seizures, not seizure, we can see if they stop. So if all of a sudden we see a discharge and they stop and then go back to tapping, then that discharge that we saw on their brain waves might actually not just be in between phenomenon. It might actually be that a small seizure because it's impacting their ability to interact with their surroundings. That is important, obviously, because when we're driving, it might be difficult for you to just stare off for a few seconds and then all of a sudden realize you're on another part of the road. So it gives us more information. Cardiac. So there are cardiac conditions that might also require a medical advisory board evaluation. Now, this is kind of interesting because there are a lot of individuals who might have some of these as well and never even considered, why would I ever need to be evaluated for my driving? I will say that the most important thing is that you have to figure out if there's ever been a history of loss of consciousness awareness or bodily control, and then whether or not it's been prompted to have to go to the DMV. So has there been a car accident and someone has these issues? Or are they having clinically, from a provider perspective, having clinically episodes where they have this known issue and they're telling you that they're losing awareness for a few seconds per day, or family members are seeing them stare off and they have ventricular tachycardias, atrial fibrillation, or other arrhythmias where the heart isn't beating correctly, uncontrolled hypertension. So if their blood pressure all of a sudden goes really, really low, goes really, really high, they might be confused. So things to keep in mind, as well as coronary artery disease and pacemakers and heart defibrillators, kind of in the same nature as an arrhythmia. From an endocrinology perspective, this is very commonly seen by the medical advisory board for things that may impact their awareness. I just want to take a quick look, see. So the individuals who have diabetes, there's always a risk that a diabetic driver is at risk for hypoglycemic events. So their blood sugar drops out, they might become more confused, lose awareness of their surroundings. Sometimes this can be provoked. So if they have a clear excess of insulin, or they accidentally took too much of their medication and now all of a sudden their blood sugar drops down, that can obviously affect their awareness of their surrounding. Glucose monitoring may actually be considered a form of definitive treatment. Of course, all of this is a little gray because you need to find out if this is a notorious thing. They have recurrent episodes because their blood sugar keeps dropping down. Then this might impact whether or not maybe they should wait at least 6 months, or maybe they might have to wait even a year before they can drive based on the medical advisory board, rather than saying, oh, it was a one-time thing because I took too much insulin. Sleep. So there can be driving restrictions based on sleep. So medical advisory board may receive a request if there's an accident where the driver fell asleep or was fatigued and drowsy. They usually will need a statement from a sleep specialist or documentation of a sleep study because sometimes they might have undiagnosed sleep apnea. They might have narcolepsy. They could have a lot of different things. Um, and You also might need documentation if the patient is not being treated or refusing treatment. So if they have obstructive sleep apnea, they've had episodes where they're losing awareness, and then you find out that they do not want to take their CPAP for breathing at night. That is a little tricky because that might mean that you need to be enrolled in this program, and we have to make sure that we see that you're taking your CPAP and you're continuously using it. Um, and Sometimes they might even recommend that there's at least 1 month of compliance before they'll even consider reinstating your license because they want to make sure that you're actually staying on top of it, and then follow up in maybe 6 months following that. But that 6 months you'd be able to drive. Um, so if treatment is prescribed and the patient may safely operate the motor vehicle, they'll get driver approval, and then they might need a 1 year follow-up statement after the fact, kind of like what we were just talking about. Um, and the statements should usually indicate that treatment is occurring and the driver can safely drive the vehicle. They're usually released from further follow-up after 1 year. Um, as I said before, there are specific special instances with a lot of these recommendations. So just keep that in mind. Just because you're like, well, it said I should be fine after 1 year, there could be things that muddy that. Maybe not taking the medication, or maybe some other thing pops up that causes the person to have a car accident, God forbid. If someone already has a prior sleep disorder, the medical advisory board needs to review what happened with the accident. Um, they want to make sure, was there another explanation of the accident? Is this the explanation of the accident, or a satisfactory reason? And then the recommendation is to either accept the statement and allow retention, restoration of driving privileges, or suspend the driving license privileges with stipulation, and say, no, you can't drive until we see that you're back on your CPAP, or that your narcolepsy is efficiently treated. Or they might say, we need more information. Like, when was the last time this person had a sleep study? Were there any new medications that made them drowsy at the time more than usual? Um, had the person been working a very long shift, for example, and it was the middle of the night? Um, Psychiatric, there can be psychiatric reasons for driving restrictions. Medication compliances, hospitalizations, that's definitely something to consider. You also want to monitor, the medical advisory board will want to monitor for concern of self-harm or homicidal intent. Individuals who have tried to kill themselves by driving, that would be a reason to have restrictions. Um, and then controlled substance use should be closely monitored, and that's more for the providers that might be on the call at this time, but also noting that other individuals might need to keep that in mind. I think this is an important concept as well, just for the sheer fact that there is a lot of psychiatric comorbidity, obviously, in epilepsy. Um, as with everything else, sleep disorders with epilepsy, cardiac disorders with epilepsy. Um, Unfortunately, there can be a risk for individuals with epilepsy to commit suicide, usually by ingestion of narcotics or something along those lines. But any reason, there is a risk of that. So sometimes the driving restriction might not be because of their epilepsy, but rather because of other things that are going on. Um, so now we'll talk about the impact of this driving restriction on not only the patient, but also providers. Um, So with this, 73% of people with epilepsy have a driver's license compared to 94% of general adult population. So this is kind of bringing it back to the beginning, just showing you once again, why is this? Why do people with epilepsy don't have their license as much as people who don't have epilepsy? Um, so one is the concern for self-harm or harming others accidentally, um, kind of talking about that uh, psychiatric component, but also obviously no most people don't want to hurt other individuals, and as a result, if they ever did, they would feel terrible. So a lot of individuals will even tell themselves, no, I don't want to drive. I don't want to put that on someone else, that if I had a seizure, um, I could harm someone else or harm myself. There is the social stigma as well. It's rare now, thankfully, but I've had individuals come in and say, I can't drive because they said I have seizures and I can't drive. It's an older mentality. It's a mentality that also went with people being told that they couldn't have children because they have epilepsy. Um, so luckily, as time is going on, that's decreasing. And then realistically, the big reason for why people don't drive or can't get their license or how do I get my license, these rules and regulations can be very vague. Even as I'm telling all the different guidelines of here's 1 year, here's 6 months, here's 3 months. There can be stipulations that can be outside of that. And then in addition, it's not necessarily a common knowledge place for a lot of these things. Like you can go onto the DMV website, but sometimes that can be lead to a lot of confusion. Each state is different. So what happens if I'm in Massachusetts and I come to New York or I'm going to Vermont? Do I need to notify every single person that I have epilepsy? Where do I live now? I'm going off to college. Who should be filling out this paperwork? Do I need to fill out the paperwork? All of this is vague. Um, but hopefully we'll keep talking about this and try and clarify as much as possible. I think this is all really important because driving is considered a key measure of quality of life, especially in quality of life of epilepsy inventories, the QOLIE. Um, Everyone wants to drive. Well, most people want to drive. Some people say, no, that's okay. I'd rather be chauffeured. Um, a lot of the parents are probably agreeing to that right now with their children. But it it allows for independence, and that independence can blossom into other things as well. The ability to stay employed, staying employed being the main thing, but sometimes even becoming employed. If you can't drive and you become more reliant on bus routes or other forms of transportation, Uber, what have you, it could be expensive, it could be timely, and it could really affect, tardiness and other things that might impact your job. Um, Driving also can, your personal worth. If you have a car, people might put a lot of pride into their car and put a lot of pride into the ability that they can maintain their license and use it and present it whenever they go to situations that calls for a form of identification. Um, so it is an important concept and an important facet of day-to-day life for individuals, especially those who feel like it's being denied to them. Um, This is a big one because epilepsy patients very frequently will ask about, hey, can I come off my med? Hey, can I come off my bed? Hey, can I come off my med? Um, and sometimes it's one med and they're on four, which obviously we want people to be on the least amount of medication as possible. Or it could be they're on one med and they haven't had a seizure. Why am I still on this med? Um, no specific guidelines on this. There have been a lot of surveys that have been brought out, and there have been a lot of recommendations that may be put out, but there's no specific, yes, you need to do this if there is ever a seizure medication taper. Um, they did a study where they showed 80% of epileptologists in the United States recommend no driving for 3 months during that taper. Um, it's not a reportable thing. It's just a recommendation to the individual saying, if we're going to come down off this med, I don't think you should drive for 3 months. Um, that could go in a few different ways. Because that might also become hard because some people will say, well, why aren't I being counseled on that every single time? Um, it's not a guarantee that, well, especially it's case by case. That's the long and short of it. If you have someone who's on multiple medications, they might have enough coverage, quote unquote, that there's a much decreased risk that they would have a seizure, especially if they're on a med that, it's clearly not, it hasn't had any change. Um, but a lot of it comes down to what types of seizures the person's having, how frequently they're happening. Um, are there ongoing evaluations that are occurring? Um, and what has their seizure freedom been? So if they haven't had a seizure in 10 years on a medication, one, I usually tell people, why are we coming off of it? Unless there's a medical reason, like they're having side effects from it, I would recommend just staying on it. But if they are that far off, that's different than someone who's been 6 months seizure free, and they're like, hey, can we come off our med? And I'm like, you haven't even gotten to the point where I can recommend you keep driving, let alone come off a med and drive again. Um, so it can be different. Um, so there was a study that showed that a little over 1,000 people with epilepsy had a 30% risk of seizure recurrence within the first month after the withdrawal. So it's not a large percentage, but it's a percentage, a third of people. Um, but once again, the longer episode free period does indicate decreased risk. So, like I said, it's not a statement that you can just say to every individual who has epilepsy, like, hey, why don't we have you come off your med and just keep driving away? It does take some thought. Well, people with epilepsy are at a higher risk of experiencing a pretty serious motor vehicle accident. So of course I'm telling all these different facts about, hey, why don't we have you come off the meds, or hey, don't worry, we can approve you to drive after 6 months. In general, there is 1 to almost 2 times more likely to have a motor vehicle accident. And this is kind of a scary fact, but 8 to 18% of them were due to their first seizure. So I think that's scary for everyone involved, because people who do have epilepsy, people who don't have epilepsy, there's a chance that someone on the road is going to have their first time seizure ever while driving. Um, it's, you know, we also have to, once again, think about quality of life and what it's not everyone who would have that, but just information is important in this. Um, Just looking at other groups, by the way, motor vehicles in diabetic patients are 30% more than in non-diabetics, just to give you an idea of that compared to epilepsy. People who have strokes, so people who have strokes or heart attacks while driving, that technically qualifies as you had a loss of consciousness or awareness. Now, granted, it's provoked, um, and if there's a very clear issue, that might also be something to consider. Um, and then motor vehicles in accidents in dementia patients may be 2 to 5 times higher than in controls. So it's not only epilepsy individuals who are at risk for having these motor vehicle accidents. And even if you compare, like, for example, dementia with epilepsy, it's a far higher risk with dementia than epilepsy to have a serious motor vehicle accident. I don't think I put a slide on this, but they've shown in studies that the group that is the highest risk for motor vehicle accidents are adolescent boys, especially adolescent boys, and the use of cell phones. Those are the highest risks. The cell phone issue is kind of interesting because people looking down at their cell phone is upwards in some studies twice as long of a duration of you looking at your cell phone than a lot of episodes of absence seizures. Um, Not a guarantee, but it's something to just keep in mind. There are a lot of things that can impair people's driving abilities. So, what what happens to the individual who now has to go through this? When someone has been told you cannot drive because of your seizures or any other diagnosis, they can request to appeal the decision. They can cite specific details not mentioned by a police report or physician. So they could say, like, no, 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 I don't know why this was kept out, but I forgot to take my meds that morning. Or something else had triggered my seizure to occur. Um, this was the first time I had my seizure, and it was very clearly triggered by, it could be anything. It could be alcohol use, or, their blood sugar dropped. Whatever that is, all that information is taken eventually, and then there is an actual physical court date where the medical advisory board and attorneys for the New York State DMV meet with a judge to kind of rule on a possible appeal, um, and either overturn it or more likely kind of say, well, why don't maybe they could change how long the duration is, or sometimes they just say, no, we can't really change much about this because it is what it is. But there is the ability to appeal the decision whenever the medical advisory board relates. Um, there are driving laws based on occupation that are much more specific. So it can be dependent on the laws of the employer. So sometimes the New York State DMV and the medical advisory board are kind of taken out of the equation to an extent. They can still rule on your civil license, like your license to ability to drive a car, but they might not be able to affect your ability to drive like a truck, for example, for a living, like a CDL license, or being a firefighter or a landscaper. Certain professions, if you have a seizure, you actually have permanent disqualification. Like you can never ever do that job ever again. We talk a lot about that with our seizure patients of for example, oh, I would recommend that you don't go heights greater than your own if you're a landscaper, or go on to anything that's automated, because we're talking about cars, but it's really anything that's going to be self-propelled that would bring you forward that is putting you at risk. So people who are driving a zero turn, for example, or driving a rider mower. I know there's the mechanism that you fall off and it could stop it, but if it doesn't stop quick enough and you fall off real quick, it could go over you. So it's not meant to be too anxiety provoking, but it's meant to be safe. But there are some things that you can't, as soon as it happens, you just can't do. For example, airplane pilot. Um, and but the medical advisory board, like I said, takes action on any class of driver license or permit outside of that. Looking at CDL, just because there are a lot of individuals who do have CDL licenses, the FMCSA provided guidelines for people who want to obtain or maintain a CDL license with epilepsy. So the history of epilepsy will not allow you to get a CDL license that's unconditional for interstate commerce. Um, but it will give you a conditional license from what has been supported by this document. So you can't just go in between state lines without any conditional restraints on your license if you're a CDL driver, if you have epilepsy. And they have to be recertified every single year, whereas other individuals with CDL might not have the same guidelines. Um, so here are the conditional certification that they need to have. They need to be seizure free for a minimum of 8 years. And that's either on or off anti-seizure medications. So ASMs, old terminology, AEDs. So they need to be seizure free for a minimum of 8 years in any capacity. And if their seizure meds were stopped, they need to be seizure free from the 8 years of the time of cessation of medication. Or if they're still using their anti-seizure medication, they need to be stable on that for a minimum of 2 years. Super confusing. And what this is really trying to say is be seizure free for 8 years and don't come off your meds. Because as soon as you come off your meds, it kind of resets the clock that now you need to be 8 years off meds in addition. So if you're 7 years seizure free on meds, you've met the criteria of being stable for a minimum of 2 years, and then you just have to wait one more year. And then once that happens, you've been stable for 8 years on meds. But as soon as you stop them, if you're 7 years seizure free and you're like, you know what, I don't need this levetiracetam or lamotrigine, and you stop it, now you need to wait another 8 years. That's at least based off of what this is recommending. Um, so New York State provider role documentation. In New York State, so this is kind of shifting from the patient role now to the provider role. Providers are not mandatory reporters in New York State. And this is good for the patient to know, but also providers. They can provide that form, the MV80 form, on behalf of the patient. And the MV80 form needs to be filled out appropriately and completely so that it shows the statement that the driver is a patient of the doctor. So the doctor shouldn't be fraudulently writing on their behalf, just being like, oh yeah, no, definitely, this patient hasn't had a seizure, but they've never met the patient, for example. They need to have examined them, which is part of the MV80 form. It asks when was the last time they had an examination, and it should be at least 4 months from when the document is written and signed. The names of the medication that the doctor prescribes or the patient is prescribed, especially for that specific diagnosis. So if they have epilepsy, what seizure meds are they on? And then if the patient suffer a loss of bodily control, awareness, or unconsciousness, you would think that's a pretty simple question, but that's an important part of this document because otherwise it might not affect their driving. And at the end, there is a spot that says, what is the doctor's opinion? Can the patient drive or not? There, so this is important. If someone moves to a state that is not New York, or they are living in a state that's not New York, there are some states that the doctor, as soon as you have a seizure or you tell them they have a seizure, they need to report you. They can't just say, okay, here's the law, you know, and we'll work on the paperwork later. It's we tell the DMV now. And those are California, Delaware, Nevada, New Jersey, Oregon, and Pennsylvania. So a few of those obviously are bordering around New York State. Um, so it is important to keep that in mind. Always the providers should always counsel the patient on the state law that the patient is currently residing in, not where they're from. If they are from out of state, um, usually the providers would want to contact both DMVs. This kind of goes more to the patient. You'd want to let both DMVs know the licensing DMV is the one that needs to be contacted at the end of the day. Someone is in New York State, they go out to New Hampshire, they have a seizure. Um, New York State DMV would be the one that would be the governing body. Um, it becomes tricky if, for example, someone goes in New York State and then goes down to, oh, someone goes to New Jersey and then goes out to New York and has a seizure. The New York or the New Jersey DMV would be the least that needs to be contacted. If it's a cop report or a police report, then obviously it goes right to New York DMV as well as New Jersey DMV. But usually the patient would need to contact their licensing DMV. The reevaluation program that we were talking about, New York State Vehicle and Traffic Law states that if the commissioner has quote unquote reasonable grounds to believe that a person holding a license is not qualified to drive a motor vehicle, the commissioner may require such person submit to an examination to determine their qualifications. So that's saying that if there's concern that the patient is, or the driver is having any incident, behavior, action, or other cause that led to this, propagation or furthering of their events, it needs to be reported. And that could be by the physician, police officer, or someone who knows or has observed the driver. So this is another form that the New York State DMV has available called a DS6, I believe. Which is just trying to say it's kind of like a good citizens report. So if someone sees like someone trying to back out of the parking lot and it took them 80 turns to do it and they're concerned that they've had dementia, they could potentially report this using that form. Or if someone went out into the parking lot and saw someone actively seizing and then they got into a car and drove away and they knew that person, they could potentially report that as well. If family members are concerned that, hey, so and so is not taking their medication and I'm concerned that they're actually having more seizures than they're letting people know, and here's the last time it happened, they could also report using that as well. Um, Other things that can be brought to the DMV's attention is if they've been involved in 3 or more reportable accidents. So once that in an 18-month period, if there's been 3 or more accidents in 18 months, it might be brought to their attention. And then they might say, hey, do they have any medical conditions that may have provoked this, like epilepsy or maybe diabetes or uncontrolled hypertension, et cetera? It's all ages. Reportable act. Another part of it is any reportable accident defined as an accident with a fatality, personal injury, or damage to more than $1,000 to one person. Those can also be looked into and see if there's any medical reasons as to why the person might not be able to drive. If the person's license is revoked, so say they had a car accident, it's because of their seizure, license is taken away. It's not permanent necessarily. They have to wait for 30 days, then reapply for driver's license. Now, after that happens, in some situations, the driver would have to apply for a learning permit, pass a vision test, take a 5-hour pre-licensing course, and then pass a road test before they can get their license back. So it's quite extensive if someone's license is actually revoked and they want to try and get it back. They have to go through a lot of hoops. Um, if all the requirements are met, the driver is given a new license, and then they're on probation for 6 months from the date of the test. Um, if during that 6 month time frame they are convicted of speeding, reckless driving, following too closely, or two or more moving traffic violations, they will lose their license again, or at least have it suspended. So just to keep in mind that it's not permanent, but it also takes a lot for people to get their licenses back if it has been their license has been revoked. The other thing that I would say about this is that they oh, I lost my train of thought. I apologize. The one thing I didn't include in this slideshow was initial licensing. That's a question that I get a lot, and there isn't really necessarily a hard, fast rule in that for the DMV. If someone has a history of epilepsy, it might be asked on initial questionnaires when people are applying for licenses. Um, but unless they have their license and then they have a seizure, that kind of is what would start to be more, hey, here's what the requirements are. But like sitting for tests that are not you actually driving or doing anything along that line, usually people can go and start to at least do that. If there's any restrictions that are brought in after they fill out paperwork, we usually tell people to have it brought to our attention. So that's everything from my end. Any questions?
Uh, can you hear Joanne Letner?
Yes.
So on the license revocation, and when you get your license back, is that in the instance of any license revocation due to epilepsy, or is that only if there's been the aggravated situation you gave, such as 3 accidents in 18 months or something like that?
It's so this would be any it's more along the lines of those, usually the aggravated situations. Um, and once again, it's not only epilepsy that all those would be, it would be anything where they lost consciousness or awareness, but usually the revocation is more of these more specific issues where there's been more aggressive concerns, like you said.
Okay, so if someone's had their license revoked due to seizures and they get it back, are they automatically on this 6 month probation period that you just had a slide on?
Not that I know of, not that
Okay,
I've ever seen. Um, I believe what they will be brought on is where that situation where I said they might, whatever the medical advisory board recommends, if they get their license back, they'll say they can have it, but they need to follow up once a year for the next 3 years,
gotcha.
which
Thank you.
essentially just means getting an MV80 form filled out once a year, as long as they haven't had seizures in between.
Right. Thank you very much.
You're welcome.
We sometimes at EF get consumers who called and said, "Oh, I didn't check the epilepsy box on the form when I got my license or, like renewed the license, even though they've been diagnosed and have been seizure free, but still, obviously see a neurologist regularly." So in that case, you would recommend, checking the box because they're not necessarily going to go in and get questioned.
Right. What at the worst that they would do, as long as you have not had a seizure, specifically loss of consciousness awareness, as long as you haven't had that, there shouldn't be anything to restrict your license. Now, what they may say is, okay, I just need you to have your provider fill out this form once a year for the next 3 years. Um, or they might say, okay, you haven't had a seizure in 10 years. Okay, thank you for letting us know. Now it's at least here. And it might not even get brought to the medical advisory board. It probably would, but that would be another case. And from what I believe telehealth visits might count as the 4 month time frame for MV80 forms to be filled out.
Would something like that hold up the process of getting a license or getting a license renewed?
Um, it it shouldn't. Um, it shouldn't. I mean, obviously there are times where if it's still paperwork, that's the hardest part. It's not like an online form or something that could give you instant like yes, it's there. But it shouldn't hold anything up.
Awesome. Cool. Thank you. Well, it looks like we are at the end of our time. So if anybody has any more questions, feel free to shoot me an email. You all should have received an email from me this morning after registering. So if you have any more questions, I will be happy to forward them along. But thank you all for your time. And again, if you missed anything, the recording will be on YouTube and I am available. So thank you so much, Dr. Lansing, for this today. This was super informational and we are happy to have you.
Anytime. Thank you for having me again.
All right. Have a good one, everybody. Enjoy the rest of this beautiful day.
Mhm.
Thank you very much.
Thank you. Bye.
Thank you. Bye bye.